Hello, dear aquarist. Welcome to one of my next cases of fish diseases. And this video, I will explain some nasty gill and skin fluke infections on a gourami. And I will show you my PowerPoint where I can explain you in detail what I found while I was working with a microscope and observing the fish in the aquarium. So skin and gill flukes on a Trichogaster or Trichopodus cosby, the marmorate gourami, flukes and a bacterial infection. My books on fish diseases, if you didn't buy them yet, well, you should. Still, books are important to learn about the prevention, the diagnosis with many interesting photographs, and about the application of fish medications. Here I show you the cosby gourami, and some become skinny and are wasting away. Look, this one here in the middle, it's behaving badly, skinny, not eating well, while the others are still eating well. Here is one more. You can see the fins are not well formed anymore. Fish is skinny, and he's gonna die in the next hours. And that's the one we take out for examination. And we took a skin scraping and look at the flukes. The skin flukes we found on the scales. They were very active, so it gives me an interesting observation and also for you to share. And I will share some more of these videos now because this was a different Chirodactylus than I was used to see. Very active, a very slender, moving actively. And here in these we can see inside, particularly this one, we can see inside the baby skin fluke, ready to pop out, ready to reinfect the fish and make wounds and make more damage. They are life bearers. They're hermaphrodites. They just don't need pairing. They just reproduce. And here in the gills, a lot of gill flukes. Well, this was terrible and causing damage to the gills, of course. A few are already loose from the gill tissue. Here we see it in detail. And it doesn't look like a common Dactylogyrus or a common gill fluke, a specific species. I did not do determination. It's not my job to determine what kind of gill fluke it is. That's something for taxonomists, people specialized in it, but I'm specialized in observing it's a gill fluke and that I can recommend treatments to attack or destroy the gill flukes. We found also something specific which I want to share with you. The little balls formed here on the gill tissue, the gill lamellae. Here we see many more here attached, which was unusual. I don't see that so often, was specifically something I found during my observation of these gills of this gourami. Here we see more of these at 400 magnification. And when we went more in detail, we found out that these little balls contained a lot of bacteria. You can see it here moving, a lot of bacteria. So it could have been, in my opinion, colonies of bacteria that are forming. A risk, of course, we know when parasites cause damage, a risk for a bacterial infection is very easy to come up. So here we see it again, the bacteria. Inside we found a lot of MMCs, melanom macrophage centers in the spleen here and in the kidney. Well, this is causing bad organs, causing damage, malfunctioning, and, well, needs a serious antibacterial treatment next to the parasites. So The skin and gill flukes should be treated as soon as possible. Go to your aquarium shop or ask your veterinarian or fish doctor to get the medications available. Try to combine with an antibacterial medication. We've seen the bacteria on the gills, on the internally, and at the same time, you want to help with the fish food. Yes, I recommend a functional fish food that helps to improve the immunity and the repair of the fish, like you can use Dr. BASSLEER BioFish Food Garlic. My books on fish diseases can help you. The link is below where you can order them. If you want to get more training on quarantining, on diagnosing fish diseases, go to my Patreon and maybe you can become a fish doctor. Well, this helped you to understand specific mix of gill flukes, skin flukes, and bacteria on a gourami. You like this video? Like it. You want to learn more? Subscribe. Thank you for watching.